The SEC chair just got caught taking $1,450 per hour to protect his Wall Street buddies from fraud charges. According to Elizabeth Warren's explosive September 25th allegations, Paul Atkins was literally paid by Devon Archer's lawyers to be their expert witness in 2018. And now, as SEC chair, he's dropping the securities fraud case against his former client. This is the most blatant regulatory capture scandal in American history. Atkins made a fortune defending someone accused of defrauding Native Americans, got him pardoned by Trump, and now he's running the agency that's supposed to prosecute financial crimes. Warren called it open corruption on an unprecedented scale, because the SEC has also dropped cases against OpenSea, Ripple, and Coinbase this year. The revolving door between Wall Street and regulators has never been more obvious. When the person supposed to police financial crime used to work for the criminals, you know the system is completely rigged. This is exactly why Americans have lost trust in government agencies that are supposed to protect us from corporate fraud.
Two Chinese chemical executives just got 25 and 15 years in prison for turning their company into a pipeline of poison that's killing Americans. According to the September 18th DOJ sentencing, Qingjiao Wang and Yi Chen shipped ton quantities of fentanyl precursors to the U.S. disguised as everyday goods and got paid in cryptocurrency. The most shocking part? Their company, Marvel Biotech, kept selling, even after being told Americans were dying from fentanyl made with their chemicals. They shipped over 200 kilograms of precursor chemicals from Wuhan, China, enough to make millions of lethal doses. The DEA administrator said these executives turned a Chinese chemical company into a pipeline of poison, shipping hundreds of kilos of fentanyl-related precursors into the United States. This case proves the fentanyl epidemic isn't just about street dealers. It's about international pharmaceutical companies that knowingly profit from American deaths. The fact that they used cryptocurrency shows how sophisticated these death merchants really are.
Trump and RFK Jr. just dropped the most explosive health bombshell in American history. Autism has surged 400% since 2000 and now affects 1 in 31 children. According to their September 22nd White House announcement, this represents the first official government admission that we're facing an autism epidemic caused by environmental and pharmaceutical factors. The FDA is finally approving the first autism treatment using leucovorin for brain folate deficiency, and they're issuing warnings that Tylenol during pregnancy might cause autism. RFK Jr. said, "For too long, families have been left without answers or options as autism rates have soared." The most shocking revelation is that previous estimates of 1 in 68 children were massively underreported. They're launching a $50 million research initiative using machine learning to investigate environmental, nutritional, and pharmaceutical causes that have been suppressed for decades. Dr. Mehmet Oz, as CMS administrator, will oversee Medicaid coverage for autism treatments. This announcement destroys Big Pharma's genetics-only narrative and proves pharmaceutical products have been poisoning our children for 25 years.
Big Pharma just spent a record-breaking $227 million in lobbying in 6 months to fight Trump and RFK Jr.'s health reforms. According to Sludge's August 29th investigation, this puts them on pace to easily surpass their all-time high of $388 million for 2024. Pfizer alone spent $7.8 million fighting drug pricing and vaccine policies because Trump is demanding they cut prices to match international rates. The most corrupt part? PHRMA, Pfizer, Bayer, Merck, and Eli Lilly each gave between $500,000 and $1 million to Trump's inaugural committee as a plain attempt to curry favor. RFK Jr.'s Make America Health Again initiative is threatening their $10 billion drug advertising market with potential bans. The industry is panicking because the FDA revoked COVID vaccine emergency authorizations, and Kennedy defunded $500 million in mRNA research contracts. Despite spending hundreds of million dollars on lobbying, they still scored a $5 billion win with expanded orphan drug exemptions. This proves pharmaceutical companies view lobbying as an investment to protect their obscene profits from government oversight.
A massive prescription drug freight fraud network has been exposed, shipping fake medications across America disguised as legitimate pharmaceuticals. According to the September 2025 Safe Medicines report, criminal organizations are using freight companies to distribute counterfeit drugs that look identical to real prescriptions but contain deadly ingredients. The most terrifying part is that these fake drugs are entering the legitimate supply chain through corrupted freight networks, meaning patients getting prescriptions from real pharmacies might be receiving counterfeits. The report reveals how sophisticated these operations have become, using AI-powered QR codes and professional packaging to fool even trained pharmacists. Freight companies are being paid millions to look the other way while deadly counterfeits flood American medicine cabinets. This isn't just about street drugs anymore. It's about the complete corruption of our prescription drug supply chain. The fact that legitimate-looking medications can contain fentanyl, rat poison, or nothing at all shows how vulnerable our pharmaceutical system really is. Every prescription could be a death sentence.
The DEA just seized thousands of counterfeit M30 pills containing carfentanil, a drug so deadly it's used to tranquilize elephants. According to their September 24th warning, these fake pills look identical to legitimate prescription opioids, but contain a substance 100 times more potent than fentanyl. Just touching carfentanil can kill you, and these pills are being sold to unsuspecting Americans who think they're buying regular pain medication. The most horrifying part is that carfentanil was originally developed as a chemical weapon and is so dangerous that even drug dealers are accidentally killing themselves while handling it. These aren't street drugs, they're weapons of mass destruction disguised as medicine. The pharmaceutical supply chain has become so corrupted that military-grade chemical weapons are being pressed into pills and sold as prescription drugs. First responders need special hazmat equipment just to handle overdose scenes because the air itself becomes toxic. This represents the complete breakdown of pharmaceutical safety in America, where chemical weapons are being marketed as medicine to maximize profits.
The DOJ just announced the largest healthcare fraud takedown in U.S. history, with 324 defendants charged for over $14.6 billion in fraud. According to their June 30th announcement, this represents an explosion in pharmaceutical and medical corruption that's systematically stealing from Medicare and Medicaid while patients suffer. The most shocking cases involve doctors prescribing unnecessary procedures, pharmacies billing for drugs never dispensed, and medical device companies paying kickbacks for implants that don't work. This isn't isolated fraud, it's systematic corruption where entire healthcare networks are designed to steal from government programs. The $14.6 billion stolen could have provided healthcare for millions of Americans, but instead it went into the pockets of corrupt doctors, pharmacists, and pharmaceutical executives. The takedown reveals how Medicare and Medicaid have become piggy banks for healthcare criminals who view patient suffering as profit opportunities. Every fraudulent claim means real patients are denied care while criminals get rich. This proves the entire healthcare system has been weaponized against the American people.
Pharmaceutical companies have been systematically suppressing cancer research that threatens their trillion-dollar treatment industry. According to multiple whistleblower reports, Big Pharma has buried studies showing that cheap natural compounds can effectively treat cancer because they can't be patented for massive profits. The most explosive revelation is that companies have been funding contradictory studies to muddy the waters around promising cancer treatments that would destroy their chemotherapy monopoly. Internal documents show pharmaceutical executives discussing how to manage research that shows their expensive treatments are less effective than natural alternatives. This isn't conspiracy theory, it's documented corporate strategy to suppress life-saving information to protect profits. The cancer industry generates over $200 billion annually, giving companies massive incentive to hide cures that would eliminate their revenue streams. Researchers who publish positive results about natural cancer treatments face career destruction and funding cuts. Meanwhile, patients die from toxic chemotherapy while effective treatments are hidden in pharmaceutical company vaults. This is medical genocide disguised as business strategy.
The revolving door between pharmaceutical companies and government agencies has reached unprecedented levels of corruption, with former FDA officials now running the companies they used to regulate. According to recent investigations, over 75% of FDA officials who approve drugs end up working for pharmaceutical companies within 5 years of leaving government. The most shocking example is former FDA Commissioner Scott Gottlieb, who now sits on Pfizer's board after approving their COVID vaccine for emergency use. This isn't coincidence. It's systematic bribery where pharmaceutical companies reward government officials with lucrative jobs for favorable decisions. Current FDA officials know their future paychecks depend on keeping pharmaceutical companies happy, creating massive conflicts of interest in drug approvals. The same pattern exists at CDC, NIH, and every health agency where officials make decisions worth billions to pharmaceutical companies. Former regulators become pharmaceutical lobbyists who then influence their former colleagues still in government. This creates a closed loop of corruption where public health decisions are made based on future job prospects rather than patient safety.
California's Inland Empire Health Plan just got sued by the DOJ for stealing $320 million from Medicaid patients while denying them life-saving care. According to the September 24th lawsuit, this massive health plan systematically defrauded Medi-Cal by collecting payments for services they never provided, while patients suffered and died. The most outrageous part is that executives got rich by literally stealing healthcare money meant for California's poorest residents. This isn't administrative error, it's calculated theft, where health plan executives viewed patients' suffering as profit opportunities. The $320 million stolen could have provided health care for hundreds of thousands of low-income Californians, but instead it went into executive bonuses and shareholder profits. The lawsuit reveals how Medicaid has become a feeding trough for corrupt healthcare companies that view government programs as easy money. Patients were denied medications, surgeries, and treatments, while executives bought mansions with stolen healthcare funds. This represents the complete moral bankruptcy of America's healthcare system, where the most vulnerable patients are systematically robbed by the companies supposed to care for them.